probably know your heart is your most important muscle, so taking care of it is vital. Will vitamins help? Great question. Our Heart Insider has the answer. So let's talk about patients. Do they come up to you and they say, you know, I'm thinking about vitamins, supplements for heart health? Doctor, what do you think?
Actually, it's the other way around.
You tell them.
No. Patients read it on the internet. They talk to their friends. They talk to Aunt Tilly.
They say, hablé con mi tía, right? I spoke to my aunt.
That's right. Mi tía. And the tía says, oh, it was wonderful for me, you got to take it. So more money is spent on nutraceuticals, on supplementals, than there is on pharmaceuticals.
Really?
Yes, billions of dollars in supplemental medications.
So what gives there? Is it just people just think, oh, this is safe for me, it's natural?
True, but it's also, they're trying to take control of their health. They want to do something that makes them feel good, something that makes them live longer. They think they're doing the right thing, and in some instances they are.
But
in other instances, they're not.
Okay, great point there. We're going to talk all hour about this. That's why this is such an important show. You're going to help our viewers kind of fortify their knowledge about vitamins and supplements because there are many good reasons to buy them, like the doctor just said, but there are thousands on the market to choose from. Let's find out what we need to know about supplements right now. Take a look.
Should I take a dietary supplement? How do I know how much to take?
Can vitamin C prevent colds?
Is it safe to take St. John's wort with medications?
Where can I get reliable answers?
People have a lot of questions about dietary supplements.
They come in many forms like tablets,
Capsules.
powders, and even drinks and energy bars.
You can get all the vitamins and minerals you need from the foods you eat.
But not everyone eats as well as they should.
So, many people wonder
if they should take a supplement like a multivitamin.
Scientific research shows that some dietary supplements are beneficial.
Taking folic acid helps prevent birth defects.
And calcium and vitamin D can improve bone health.
some supplements need to be studied more
to learn whether or not they're safe and effective.
Many dietary supplements are made from natural ingredients
that come from plants and animals.
But natural doesn't always mean safe.
There are tens of thousands of dietary supplements on the market.
It's important to be informed about what you're taking.
Talk to your healthcare provider about dietary supplements.
Discuss which, if any, might be best for you.
How much to take,
and if they could interact with your medications.
So much to talk about there, but I liked that last sentence. They could interact with medications. And I think that's important for people to realize. There could be a drug-to-drug interaction there, right?
Well, yes, there is, especially if patients, for example, are taking chemotherapy. The vitamins can decrease the effectiveness of the chemotherapy. As a matter of fact, Sloan Kettering has a website where you can go in, you can check your chemotherapeutic agents against certain vitamins. And as you know, the Miami Cancer Institute is now working together with Sloan Kettering.
All right. And the FDA also, doctor, has some red flags about, maybe combining them with other medications. Let's show some potential risk to our viewers. And they say it can interfere with prescriptions, unsafe or unknown ingredients, overuse. Your thoughts on this?
That is absolutely correct. As a matter of fact, there are over 60,000 instances of overdose or toxicity from vitamins each year reported to the Poison Control Centers.
Over 60,000?
60,000 per year, because people think if 2's good, 10 must be 10 times better. Well, why not?
Gosh.
But we have to look at the evidence. Do the vitamins, do the dietary supplements work? Now, it's really grates me the wrong way when patients say to me, or people say to me, they begin to denigrate the doctors and say, oh, doctors, they don't study vitamins. In fact, they only study it one day. And on top of it, I think my doctor was absent that day.
Oh, please. Certainly not true.
In order to promote their opinion or justify their taking all these dietary supplements, to say, doctors really don't know.
Right.
But let me tell you, if there's a supplement that works, it has evidence that it works, we embrace it. We have no private agenda to promote pharmaceutical medication. We don't get any kickbacks from pharmaceutical.
Of course not.
Well, we're just trying to promote good health. We want to do what's good for you. But what we want to see is evidence.
Evidence-based medicine.
Evidence-based medicine. Does this really work? Is this subjected to some type of scientific scrutiny? Just because your Aunt Tilly took it 3 months ago and she's still alive doesn't mean that it really worked.
Agreed.
You got to have at least 100, 500, 1,000 patients where you could see that actually it worked. Vitamin C is a perfect example. We have 5 different clinical studies to show that, and it's up to 100,000 patients in these clinical studies. Vitamin C does not reduce the length of a cold, does not improve your immune system, does not decrease the effectiveness of antihistamines. In fact, vitamin C is a mild antihistamine, so it lets you feel like you think you're getting better. It doesn't prevent colds. I'm sorry.
So a lot of us just kind of boost it up
Now,
when we get sick.
you want to take a vitamin, you can, but there's a great placebo effect.
There you go.
And I want to talk to you for just a minute about the placebo effect.
Absolutely.
Because placebo effect is very important in the practice of medicine.
Define placebo for our audience, if you don't
It's
mind.
a sugar pill, an empty pill, an empty capsule.
And you think you're taking the real thing.
You think you're taking, I had one patient that I was trying to treat her rhythm disturbances, and I was giving her antiarrhythmic type medication. And she would call me the next day and say, "Doctor, I was on the floor, I was dying, this pill you gave me was horrible." And I would go pill after pill, different types of pills. And so one day, after about trying 6 different types, she'd call me every day, tell me how she was lying on the floor. I gave her a placebo. I said, "Celia, go home, take this."
And you didn't tell her it was a placebo.
No. She calls me the next day and she
I
says,
feel great.
"Doctor, I'm lying on the floor. You're trying to kill me."
Oh.
No, I says, "Celia, take a look. Open the pill.
It's nothing.
It's empty."
Look
she
at
says,
that.
"Oh, wow. I really am crazy, aren't I?" I said, "No, Celia, you're not crazy, but this is the placebo
But that's a good
effect."
point, doctor, and I'm really glad you brought
When
it
a
up.
doctor tells you this pill is going to help in your depression, yes, it may help, but also the very fact that the doctor tells you it's going to help
Helps
has a
you.